With Toronto and Peel Region a few days into a temporary modified Stage 2, we're still seeing an alarming amount of COVID-19 infections across Ontario. The province releasing 2 sets of numbers today, including data from Thanksgiving. 746 new cases are being confirmed today, along with 807 infections from yesterday. The province did not report case numbers on the Thanksgiving holiday. There are 9 additional deaths recorded, bringing the province-wide total to 3,017. 1,968 of those were long-term residents. The rolling 5-day average now sits at 602. That's down nearly 100 from Friday. As for the provincial hotspots, Toronto is seeing 311 new cases. There are 135 in Peel and 116 in Ottawa. There were nearly 68,000 tests completed in the last 2 days. And today, the Premier said moving Toronto, Ottawa, and Peel to a modified Stage 2 was one of the toughest decisions he's ever had to make. Even though he says it will prevent a full-scale lockdown, he knows how devastating this will be for businesses. But today, the Premier was asked repeatedly why he didn't make the move sooner. As case numbers, hospitalizations, and deaths climb across Ontario, questions tonight about whether or not the Ford government waited too long to impose restrictions in 3 hotspot regions.
So many armchair quarterbacks that can sit back and haven't walked a mile in our shoes, and it's easy to say could have, should have.
But some of those so-called armchair quarterbacks are health professionals working on the front lines who have been raising concerns about the disturbing metrics they've been watching closely for weeks. And despite the closures announced on Friday, predictions now, the numbers are only going to get worse.
Unfortunately, I think we're going to see a big bump in 1 to 2 weeks from now. I'm hoping I'm wrong, but that's what it looks like might happen.
The Premier says he relies on advice from the medical officer of health. So today we asked Dr. David Williams why the decision to close indoor dining at restaurants as well as fitness centers and gyms wasn't made sooner. He says there were other areas of concern they targeted first, like large social gatherings inside homes, announcing extensive fines to come down on those activities. And they also went after bars and clubs not following the rules.
So our steps on the last week weren't the only steps. That was our 4th in a row.
Ontario's health officials had projected 1,000 cases per day in the first half of October. Dr. Williams is optimistic Ontario hasn't reached that level yet.
We're not seeing that, fortunately, so that trend may be a good sign.
The closest the province came was on Friday, with a record high 939 cases when the closures were announced. The Premier says no matter what decision he makes, he is stuck between a rock and a hard place.
Do you know what happened? I have some people saying you could have done it a few days earlier. I have the other group that you're talking about, you should have never done it. You should just open up everything and everyone go hog wild. And I have to get the ship down the middle of the lane there.
The medical officer of health also had some Halloween advice today for regions outside of hot zones. He said the public can trick or treat outside, be careful about how they're handling and handing out treats, to always wear facial coverings, and masks for costumes don't count, and not to linger on porches and no big parties. He's still waiting for specific guidance for Toronto, Peel and Ottawa.